During slavery, enslaved black women were often subjected to medical experimentation and procedures without their consent or consideration for their well-being. They were viewed as property rather than individuals with rights, and their bodies were used as objects for medical research and experimentation. Enslaved women were subjected to gynecological procedures, such as forced sterilizations, without anesthesia or adequate post-operative care. Between 1845 and 1849, Southern-born slaveholder James Marion Sims, a white doctor in Montgomery, Alabama, credited as the father of modern gynecology, developed pioneering tools and surgical techniques related to women's reproductive health. But because Sims's research was conducted on enslaved black women without anesthesia, medical ethicists, historians, and others say his use of enslaved black bodies as medical test subjects falls into a long, ethically bereft history that includes the Tuskegee syphilis experiment, a notorious and unethical clinical study conducted by the United States Public Health Service in Tuskegee, Alabama, from 1932 to 1972. While some doctors didn't trust anesthesia, Sims's decision to not use it or any other numbing technique was based on his misguided belief that black people didn't experience pain like white people did. It's a notion that persists today. Though the potentially life-threatening experiments caused excruciating pain, Sims legally needed permission only from the enslaved women's owners. Today we know 3 of the names of the female fistula patients from Sims's records: Lucy, Anarcha, and Betsy. The first one he operated on was 18-year-old Lucy, who had given birth a few months prior and hadn't been able to control her bladder since. Lucy endured an hour-long surgery, screaming and crying out in pain as nearly a dozen other doctors watched. Lucy's agony was extreme. She became extremely ill due to his controversial use of a sponge to drain the urine away from the bladder, which led her to contract blood poisoning and almost took her life. It took Lucy 2 or 3 months to recover entirely from the effects of the operation. For a long time, Sims's fistula surgeries were not successful. After 13 operations without anesthesia on one woman, a 17-year-old enslaved woman named Anarcha, who had had a very traumatic labor and delivery before he developed a repair technique that was deemed safe to attempt on white patients. Unable to withhold consent, Lucy, Anarcha, and Sims's other enslaved patients were powerless to protect themselves from medical exploitation. He finally perfected his method after 4 years of experimentation. Afterward, he began to practice on white women, using anesthesia, which was new to the medical field at the time. Sims's racist beliefs affected more than his gynecological experiments. In the 1850s, Sims moved to New York and opened the first-ever women's hospital, where he continued testing controversial medical treatments on his patients. When any of Sims's patients died, the blame, according to him, lay squarely with the sloth and ignorance of their mothers and the black midwives who attended them. He did not believe anything was wrong with his methods. Before and after his gynecological experiments, he also tested surgical treatments on enslaved black children in an effort to treat neonatal tetanus with little to no success. Sims also believed that African Americans were less intelligent than white people and thought it was because their skulls grew too quickly around their brain. He would operate on African American children using a shoemaker's tool to pry their bones apart and loosen their skulls. According to him, enslaved women with fistulas were likely to have wanted the treatment badly enough that they would have agreed to take part in his experiments under any condition. But history hasn't recorded their voices and consent from their owners, who only had a strong financial interest in their recovery as the only legal requirement of the time. Sims's practices ignited controversy during his lifetime. The medical community debated his methods, and some of his white colleagues even openly objected to his experiments, saying he took things too far. But it was not until 2021 that a new monument unveiled in Montgomery, the Mothers of Gynecology, in honor of Anarcha, Lucy, and Betsy, as an endeavor to change the narrative. They're not mentioned in any of the iconography or the information, while a statue of Sims still stands at the Alabama State House in Montgomery. A statue of him in New York Central Park was taken down in 2018 as criticism grew over the ethics of his medical advances.